Hepatocellular carcinoma. Definition. What is hepatocellular carcinoma? Hepatocellular carcinoma is the most common type of primary liver cancer. It most commonly develops in people suffering from chronic liver diseases such as cirrhosis caused by hepatitis B or C.
Carcinoma is the primary cancer of the liver. It's a cancer that develops primarily in patients who have liver cirrhosis. Um, it's the third most common cancer in the world and one of the leading causes of cancer death. The reason it develops is because when patients become cirrhotic, their livers become nodular and inflamed, and tumors develop in these inflamed nodules. The major cause for hepatocellular carcinoma has been hepatitis C, which has been one of the leading causes of cirrhosis. But more recently, we're seeing increasing numbers of patients with hepatocellular carcinoma who have fatty liver disease and have fibrosis, not just cirrhosis. So any inflammation in the liver can cause these tumors to develop. For most patients with hepatocellular carcinoma that present to our center, we evaluate them for liver transplant if they come in in the setting of cirrhosis. The other option is surgical resection or cutting the tumor out. For the
Applications in medicine. Patients with hepatocellular carcinoma limited to the liver should be listed for a liver transplantation, even if local curative therapies are applied. In patients with a well-preserved liver function and intermediate stage hepatocellular carcinoma, TACE is the standard of care, but the decision between laparoscopic resection, ablation, and/or TACE or SIRT should be based on a interdisciplinary evaluation.
As we noticed, the patient end up on lenvatinib. At the moment, there are at least, or actually, there are only two drugs available at the moment as first-line therapy, and both are FDA approved. Sorafenib, which we are all very familiar with, it has been on the market for almost more than 11 years, and it was really the sole choice of therapy that's available for our patients. But as of August 2018, we have the advent of lenvatinib as an FDA-approved therapy based on a non-inferiority study where it was compared to sorafenib in this phase 3 trial, which was already published in the Lancet.
Pros and cons.
carcinoma. Chronic hepatitis B is the most common cause worldwide. Chronic hepatitis C is the most common cause in Europe. The main risk factor for developing hepatocellular carcinoma is liver cirrhosis. For example, secondary to hepatitis B and C, alcohol, hemochromatosis, and primary biliary cholangitis. Tends to present late. Features of liver cirrhosis or failure may be seen: jaundice, ascites, right upper quadrant pain, hepatomegaly, pruritus, splenomegaly. Possible presentation is decompensation in a patient with chronic liver disease.
Pros. Orthotopic liver transplantation is an effective treatment for both hepatocellular carcinoma and underlying cirrhosis, and is considered to be the best therapeutic option. Cons. Unfortunately, most cases of hepatocellular carcinoma present in an advanced stage and are not suitable candidates for OLT. Issues applied in Ecuador. The case of a 33-year-old male patient is presented. He has a history of hypertension, alcoholism, and liver cirrhosis. He was diagnosed by radiographic studies, and he was treated with a transplant.
I think that the most promising trials currently in HCC are those that are trying to combine, as I said previously, TKIs with checkpoint inhibitors. These will bring a lot of hope to patients, I would say, because with checkpoint inhibitors, we are targeting a proportion proportion of patients, let's say 40 to 50% of the patients, but all the other patients do not benefit from checkpoint inhibitors therapy. And this is because there are some mechanisms of silencing of the tumor that the tumor disappears for the immune system. And we're trying to rescue that with TKIs. And this will be the most important advancement in my view next year.
I think this is a very exciting time in ACC research. We have now 5 drugs that have been shown to have a significant and meaningful effect on patients with advanced stage ACC.
Conclusion. Management of hepatocellular carcinoma depends on the tumor stage, liver function reserve, and patient's performance status, and requires a multidisciplinary approach for optimal treatment. LT and hepatic resections are the only curative options in early stage of disease. There have been significant advances in local ablative and transarterial therapies. In the early stage hepatocellular carcinoma, RFA is equivalent to a surgical resection in well-selected patients.
We don't have different treatment options that are really based on etiology of liver disease. So the treatments that we have for patients with NASH-related cirrhosis and HCC are similar to those that we have for other etiologies. If a patient's found at an early stage, we have curative therapies such as surgical resection, local ablation, and liver transplantation, which can afford 5-year survival over 60%. If you're found at more intermediate or advanced stage therapies, then we deliver palliative therapies, and that can be either local regional, such as chemoembolization, radioembolization, or radiation-based therapies, or systemic therapies with either TKIs or the checkpoint inhibitors.